eagerness on the ground when it comes to especially the senior citizens who want to get that Suraksha Kavach, as the Prime Minister said, that booster shot to protect themselves amid the rise in cases. But decode the science with this 9-month gap, because a lot of people, especially even in my family, want to get this booster shot as soon as possible. Decode the science behind that 9-month gap between the booster shot as well and the second dose.
Okay, so this was a much awaited move by the government. We were all, as the health workers, were waiting for this move. And when it was announced, we were more than joyous, because we've seen that a lot of people who've been vaccinated have got milder symptoms, especially now with the surge in the cases of Omicron. However, this gap that was decided of 9 months for the senior citizen was on a few grounds and studies that were seen all across the world, where they've already started the booster doses. And it was seen that, especially in Delta, during the Delta virus surge and the variant, they've seen that a gap as long as 9 months had more benefit, because the antibodies that surged after, especially in people who got infected, and after they got infected, the antibodies that remained as protection, or has protected them from the severity of the infection, was calculated. And that is how they came to a conclusion that 9 months is an optimal period after which they can take a booster dose. However, even after the booster dose, it takes about 2 to 3 weeks for the immunity to develop to fight against the complications of this infection.
Right. Dr. Ramesh, I'll come to you on this point. Do you think that now the rollout of boosters is the new normal? Because India pretty much, and especially the entire world, is now caught in this cycle of easing of restrictions and relocks, easing of restrictions and relocks as the cases go up and down. Do you think now, when it comes to protecting those citizens against the rise in COVID cases, against new variants, because the virus is continuously mutating, getting boosters is like now the new normal?
Yes, getting the booster is definitely the new normal, because, you know, like how my colleague had already said, the immunity wanes off in 6 to 9 months' time. And already we have seen the data with Pfizer and Moderna. When the third dose was administered, there was a good considerable amount of immunity against the Delta as well as the Omicron. So there are other scientific publications in the public domain and peer-reviewed journal, which brings us to the conclusion, and studies done in India, yes, that the booster is needed and it's the right time, because all of our vaccines have been, the work is over. See, like I took my second dose in February. I'm almost a year without anything. So yes, it's a need of the hour. Being a healthcare professional, we all need, and this is going to be, and the vaccines is going to continue. And if you see, the virus is mutating, and today there is some reports from Cyprus. It's called Delta Micron. A combination of genetic material of Delta and Omicron has come in. And then there is also another sibling of the Omicron, that is BA1, is also coming. So we don't know how many mutations are going to come, how dangerous all the mutations are going to be. But there is a mix of infection which is going on now. And yes, the particularly Indian-made vaccines are very robust, because we have done the vaccine from the inactivated portion of the virus, both the Covishield and Covaxin, and it does give protection, as most of the strains may not be to the 100%, yes, 60, 70, 80, and sometimes it may come down, but then that is the talk of the day. And the children getting the vaccine, that is a 15 to 18, yes, it's a good thing. It is the need of the hour, because they are the board exam going students and they are going out, and also with the elderly above the age of 60, and all the healthcare workers frontline, whether it is doctors, nurses, paramedics, ambulance, housekeeping, security, everybody needs it. And like rightly you have said, the number of doctors who have fallen already sick and admitted. So if they are again sick, how the healthcare system will run. So this is the new norm. But again, I would like to tell my viewers, yes, the vaccine gives you protection to a certain extent, maybe 60, 70, some vaccines 80, but then double ply masks, maintaining distance, avoid crowding places, sanitizing your hand, always remains throughout. And this is going to be the norm of the day, and we have to live with the virus.
Yes, and I completely agree with you that this is now likely to be the new normal, given the fact that there is this constant up and down. There is this ebb and flow and this rise and fall of COVID cases where we have to relock and then the restrictions are eased and we see those crowds back in the markets, back in those public places all over again. Dr. Dua, I want to take this point to you. Now, when we look at the West, we see a very strong anti-science movement even today. Even today, there is a strong resistance to vaccines. Now, whenever the vaccines are rolled out in India, especially in the wake of the second wave, which saw that devastation across the country, now we are seeing a lot of enthusiasm among people to go and get vaccinated. People want to be safe as soon as possible. We saw it when teens were eligible to get vaccinated. There was a lot of enthusiasm among them because they felt that they were doing a national service. And now even among the elderly, there is this kind of enthusiasm to go and get inoculated so that they can protect themselves, because they are the most vulnerable, one of the most vulnerable in the country. Would you say that India has seen the end of vaccine hesitancy, or almost the near eradication of vaccine hesitancy?
I'm really glad you put forward this point. Also, I'd like to put across that whatever cases that we've seen recently in the surge of Omicron variant, the 90% of the cases who've been vaccinated have got really mild symptoms, and most of them have not required any hospitalization, or they have come up with just some mild symptoms like cough, running nose, and mild fever. And also most of them got recovered in about 5 or 6 days of time. And who have not been vaccinated, were not vaccinated for whatever reasons in the last time when this vaccine rollout had started, have seen some severity in their infection, have seen requirement of hospitalization. Also, a few elderly who could not be vaccinated have been hospitalized due to the high risk of the age, of other factors like heart diseases or lung diseases. But yes, now since people have come to know the awareness, people are more cautious about what symptoms can be presented, how they can prevent hospitalization. I think that has brought them to the fact that they can reach out to vaccines very easily. The government has made such robust drives to make sure that the vaccines, the vaccination sites and the centers are nearby. They can approach very easily. They can get registered hassle-free. They do not need any doctor's prescription to get registered to the vaccination centers. Also for the kids, there have been multiple centers, including schools now, where they can just walk in and get vaccinated. So I think it is a great move. The government is working really hard to make sure that each of us gets vaccinated, each of us gets a booster dose soon enough. And also we are more able to fight, and we were stronger to fight against the coming variants of the COVID-19 virus. Although we do not know much about the effect of the vaccine on Omicron, but we're very sure that whatever the trend has been going on since the last few weeks with the resurgence, we've seen very mild signs and symptoms even with the Omicron variant now. So I'm sure that whatever this is, the vaccine hesitancy has reduced, and it must, and it should be made clear to everyone that in some or the other way, vaccines have really helped us, and even the burden on healthcare workers have reduced due to reduced hospitalization after vaccination.
Right. Thank you, Dr. Dua and Dr. Ramesh, for joining us on the broadcast and giving us your take. But as Dr. Ramesh was pointing out, that this is likely to be the new normal, the rollout of boosters every couple of months as COVID cases rise and then fall. It will be necessary for all of us, for all Indian citizens to re-empower, if you will, or to reinforce our Suraksha Kavach when it comes to protecting ourselves against the COVID virus. And as Dr. Dua is pointing out, the encouraging sign in India is that vaccine hesitancy is almost negligible now. Now, getting this report from Jammu and Kashmir, come rain, snow or shine, the Union Territory's health